My name is Lauren Jackson. I'm here to present my case study for the signature case assignment. So my clinic is actually an internal medicine practice in Menifee, California. My patient's initials for this case study are ES, and his date of birth is June 2nd, 1992, making him 28 years old. Patient is a 28-year-old white male. The patient's chief complaint was toe pain in all 10 toes and the separation of his toenails from the nail beds. The patient's symptoms started 5 days ago when he noted the toenail separation. To palliate his pain from the toenail separation, he's taken about 650 milligrams of Tylenol, which he took on one occasion, which helped minimally. This case is interesting to me just because I've only seen onychomycosis once in a clinical setting. And when I did, I didn't see any evidence of any separation of nails from the nail bed. For the patient's past medical history, the patient has a medical history of athlete's foot. He's also overweight. He has no other medical history or medical conditions. His only medication that he takes is Tylenol as a PRN. He's not on any medications. For his social history, the patient lives with a roommate in a 2-bedroom apartment. He works full-time, about 60 or sometimes even more hours a week, working about 12-hour days. He works in construction and he's consistently wearing steel-toed boots. For his diet and exercise, he rarely exercises. Mostly he's just walking at work and he really has no time for exercise. His diet really consists of a lot of processed foods. He does a lot of takeout. He consumes meat, cheese. He also consumes some vegetables and fruits. However, the majority of what he eats is processed. So as far as his family history, both of his parents are alive. He's an only child. Mother is age 54. She's healthy. She has no known medical problems. The father is 59 and he's been diagnosed with hypertension. For his pertinent review of symptoms, constitutional, the patient denies any fever, sweating, and any recent illness. For his skin, which is the next pertinent system, patient endorses pain in all of his toes and endorses separation of nails from the nail beds. For the objective information portion, the patient's vital signs were all within normal limits. The physical exam yielded that there was some yellowish streaks noted on the toenails, on all toenails. And his toenails were noted with separations. There weren't any exudates or drainage or any signs of infection noted on the nail beds. For diagnostics, there were no diagnostics done, but a KOH study or scrapings of the skin could have been done. For differentials, I chose onychomycosis as my number one diagnosis, or my leading diagnosis, and then the secondary diagnoses that I chose were nail psoriasis and lichen planus. So I ruled out the nail psoriasis. I used Medscape for my list of differentials, and nail psoriasis was ruled out because the patient does not have any medical history of psoriasis, and usually nail psoriasis is associated with a history of psoriasis. For the lichen planus, that was ruled out just because the presentation, there weren't any portions of the patient's skin that had any rashes or anything indicating a rash outside of just the affected nail beds. And for the plan, I chose to use terbinafine as a medication because terbinafine is indicated for fungal infections of the nails. Epsom salts were also prescribed because just the Epsom salts, they can decrease pain, promote circulation. And for Another treatment modality, ventilation. The patient was encouraged to let his feet ventilate by taking his shoes off at least once or twice a day during lunchtime. And ventilation is important just because fungal infections tend to thrive in like humid and moist settings. So that was just to help decrease the fungal infection. And for the holistic approach, so I chose to collaborate with the patient on his holistic approach. The way I did that was discussing with the patient, his work duties and how often he's at work, when he has time for a break. And he revealed that he doesn't have a lot of time for lunch, but he does take lunch breaks. So we're able to agree upon a time that he could actually take his shoes off and have some time to let his feet ventilate and rest. And as far as the Jean Watson's caring process, I felt that I was able to achieve the maintaining human dignity caritas, which is just focused on, helping patients understand that they're cared for and that, their respect is really foremost. And so that was achieved by, really considering the patient's job and, making sure that he was resting his feet and just really not conveying a judgmental tone, not making the patient feel bad for having like a strenuous kind of like manual labor job, which, that could easily be conveyed, just with a tone of voice. So with the evidence for the holistic approach, so I used a holistic approach by utilizing both pharmacological and non-pharmacological interventions. So the Epsom soaks were very homeopathic or holistic because they, promote relaxation. They're not, there's something that just kind of encourages relaxation and just a decrease in pain, in addition to giving just, NSAIDs or something for pain. And ventilating the feet is also very holistic because it really just takes into account, again, the patient's workday and what works best for him. So that was achieved with that. So that is the conclusion of my presentation. Thank you.